speed did help me a lot too. It gives you a guidance, it gives you a direction as to how to prepare, what can you expect, what are the kind of questions that they can ask from. Speed, good faculty team, even the general anesthesia part was very good. I really enjoyed his lectures very much.
So I bring in all the wishes and greetings on behalf of all the faculty members from Speed Medical Institute,
Thank,
Dr.
thank you so
Aishwarya
much.
Venugopalan, for scoring
Thank you,
rank
sir.
number one in DM Onco Anaesthesia in NEET session November 2025. Congratulations to you, doctor.
Thank you, sir. Thank you very much.
Thanks for your time and sharing your experiences with us.
Sure, sir.
Can we get to know your basic brief background from where you started till date? What have you done?
So I did my MBBS from AIMS Jodhpur, and post that I actually did my DNB from Manipal Hospital, Bangalore, Old Airport Road, and then that's where actually I gained an interest in onco anesthesia. And then I had graduated recently, and then I went on to give this exam. And I think what I would like to say to everybody who's aspiring to be an onco anesthetist would be your or any anesthesia super specialty. I think your learning starts from day one of your anesthesia course, MD, DNB. Every patient you see, every complication that you see, every points that your consultants or professors tell you or your seniors tell you, something which might seem very trivial at the time, these are these actually come into play when you see every question in the exam. It probably is not something that you revised the previous week or something. So every time you see a patient, know that it is of some use, maybe another case in the future or for an exam. And yes, of course, speed did help me a lot too. Ashwin sir's classes were very good. It gives you a guidance, it gives you a direction as to how to prepare, what can you expect, what are the kind of questions that they can ask from. And actually, what I felt is they don't go around asking something too complex. It's actually the basics that they would like to know. They would actually like to know if you've actually, how good anesthetist are you? Have you been seeing your patients well? So if I can do it, I think any one of you can do it.
Great. I mean, you are very brief and very clear on what has gone through. And anesthesia, you had a passion for anesthesia. I mean,
Oh,
how did
yes. So I actually had a passion for medicine in general. Medicine. I liked physiology and everything. And after my NEET PG entrance, the results had come, and then I was planning of joining medicine. And then it struck me, do I actually like medicine for doing a physician practitioner, general medicine practitioner, or do I just enjoy reading, knowing medicine? And then I actually went through all the branches associated with medicine. And I found many reasons why anesthesia would be a better choice for me. And not a day goes where I have regretted that choice. Every day, I'm so thankful I actually chose it. Even when I actually gave my counseling, NEET PG counseling, only anesthesia options were listed, no other branch. So that I was sure.
great, great. Now, now you said you had an interest for anesthesia and you decided
Yes,
to go on anesthesia.
yes.
How did you start your preparation? What you did to achieve rank number one?
I did not prepare to be a rank number one. I prepared to become an onco anesthetist. So that's where your mindset should be. Your passion really shows. Every time I read about a case, or when you read through chapters like thoracic anesthesia and Miller's, every line they say, it actually ignites. Oh, wow, look at the human body. How can it do that thing? So that fire, that keeps you going. I mean, I'm sure all of you, all my fellow colleagues, my juniors, everybody would have that passion. Let that fire keep glowing every day, and that would actually get you to your dream destination.
I could feel.
So,
Yeah, please go.
to be more specific, I would say concentrate on the basics, the physiology. Read through Miller. Miller is what they ask from, and take help of speed because they actually guide you. Because Miller is vast, so you can get lost in the book. So speed, good faculty team, even the general anesthesia part from Akhil sir was very good. I really enjoyed his lectures very much. As basics as ECG, ACLS guidelines, these are the things they ask. They ask you what is the mechanism of action of a particular drug, which might be a drug that we not think about. What is the pain perspective of this particular drug? We might not have thought about it in that way. So basics, concentrate on your basics. The basics are strong, you're good to go.
Great. What I could feel right now is, I mean, you are living in anesthesia.
Yes.
You are not,
Mind, body, soul.
yeah, you're not enjoying anesthesia, you're living through it. Something
Yes.
I've never seen. I mean, of course, they like the specialty, they view the specialty, they do the specialty and practice the specialty, but I could see you are in it, in all through it.
Yes,
You know,
I think it actually the anesthesia, the spark came into me. This was my first posting in internship in AIMS Jodhpur, the first 15 days, and I had no clue. I mean, you know how during your MBBS you're not so exposed to anesthesia, and then the first exposure happened then, and I gave my first spinal then. So, and then I was like, okay, this feels different. And from there, it was one step at a time. Each case, each consultants, each professor, each teacher that came along the way, be it in Manipal, be it in speed, be it my patients, they've just inspired me to, get better, know more.
great. So
Thank you.
the profession has got a a great person. Department has
Thank you,
got
sir.
and
Thank you, sir.
you will be building a, not only you will, I mean, I could foresee when you'll not only be a person, resourceful person for the DM Onco Anaesthesia, but I also see that you'll be going to contribute to your specialty a lot. And
Thank you, sir. Thank you so
you're going
much.
to
Kind
inspire a lot
words.
of people.
I hope. Thank you, sir. Thank you so much for those kind words.
Yeah. So, uh, can I know about something about the paper as such? I mean, what was your experience of this paper and also the
Uh,
part of the interview? Can you share something on that?
Yes, sir. So the paper, I would say, they weren't asking in detail. Suppose, let's say, head and neck cancer or pancreatic cancer or flap surgery. They are not asking into the details of the complications and all that. They go back to the basics. As an anesthetist, what should be your primary goal? As an anesthetist, what should be your the very basics? They go to that, and then ACLS, they gave very good importance to ACLS. Around 4, 5 questions were just from ACLS because the new guidelines had come. And then pharmacological mechanism of actions of the receptors, what receptors they act on, and all those kinds of questions. But I think if your core anesthesia, general anesthesia core is strong, you are actually in a good position. And in interview, they actually asked me about Thrive, transnasal humidified rapid insufflation ventilator exchange. So they showed me a picture. They asked me what it is, and then they asked me what are the perioperative uses. And when I started stating it, they were more interested in knowing how I have used it. When I went on saying you can use it for general anesthesia, but you can also use it as a supplementary when you do not want to give them complete general anesthesia. And they were more interested on that. So they are looking at how you have approached your patient. They want to know how what you bring to the table, not what you've read from the books alone. And then they went on to ask about rocks index and what are the cutoff, something theoretical about it. So that's what I have to say. Every patient that comes your way, you are the person, you are the patient has trusted you, given their life in your hands, and you make sure that you take good care of it throughout and post and pre, everything. Everything's important. We are perioperative physicians, aren't we?
Inspiring.
Thank you, sir.
Blowing my mind, actually. Huh?
Thank you, sir. I'm sure you would have seen so many aspirants like me.
Yeah, because I mean, I have seen thousands and lakhs of aspirants and toppers. But the kind of involvement for the specialty, I mean, I could really sense it and feel it, and the kind of
Thank you.
dedication that you have and the passion you have.
Thank you, sir.
And I also feel, and I'm going to make a request to you. I mean, if you're
Yes,
interested,
sir.
share your knowledge that you acquired for uh, for the juniors. And you are most welcome to be a part of our faculty panel.
Sure, sir. Definitely.
So in
Definitely.
case you find time.
Yes, throughout my journey. Yes, sir. I will.
think about it.
Thank you for that kind opportunity too.
So because it can help a lot of people. And
Definitely.
somebody
I would be happy to help anybody. I think anesthesia is one such branch which does not get its recognition, and for the same reason, people forget to give it the love that it deserves. Even the fellow anesthetists, I have seen them, even though they love anesthesia, they forget to enjoy anesthesia just because they somehow don't get that validation from around. I I would want to change that. I want them to look into themselves and get that inspiration and validation from within. You don't look outside. Don't think about if the surgeon tells you thank you. If your patient tells you thank you, no. You know what you've done, and then that should be good enough.
as a surgeon, I have a lot of huge honor for anesthetist because
Yes, sir.
once the head end is fine, only then the tail end will be fine.
Yes, yes. A lot of great surgeons are like that. I mean, I have nothing but sincere respect and love for my fellow surgeons, my senior surgeons, all of them.
Great, doctor. So, what is the message that you want to leave? The final go of message that you want to give through this interview to the future aspirants?
Yeah, the first day of your preparation starts the day you decide you want what you want. From then, every patient you see, every PAC that you see, every case that you hear people discuss around you, every point that your teacher or your fellow colleagues tell you, all of them, everything can come in your exam. But don't think of it in the point of exam view alone. Think of it in the point of anesthesia. Think of it as another potential patient that you might see tomorrow. So see it in a big picture, and then you will reach wherever you're supposed to reach.
The last final time to thank and whom all you want to thank that helped you to make your career till date. You can do so.
Uh, my parents, I beyond words for how grateful I am for them. My son, my 2 year old son, for being supportive in however way he could. My teachers from everywhere, from AIMS Jodhpur, from Manipal, and then now from Speed. I have sincere, hearty gratitude for all of you, and God Almighty.
Great, doctor. Wonderful having a discussion with you. And thanks for
Thank you, sir.
sharing your views
Thank
and
you, sir.
experiences and all
Yes, sir.
that you got through this. And
Thank you, sir.
we're going to wish you all the very best and all the success for a huge and amazing and a wonderful and a blessed career in the
Thank you.
Onco
Thank you.
Anaesthesia. Best
Thank
wishes.
you so much, sir. Thank you so much.